Than 2.8 million doses of the Pfizer vaccine is set to arrive in the country tomorrow from the United States. The second batch, it comes a week after Saturday's delivery. This donation of vaccine doses from the United States has been described by some health officials in the country as a positive step towards ensuring that we meet our vaccination targets. We're joined now by the founding editor of the Baker Cisa Centre for Health Journalism, Mia Malan. Mia, good evening to you. Thank you for your time once again on The Pulse. On the face of it, 2.6 million vaccine doses, Pfizer doses from the United States. It looks very generous. Should we see this as a generous donation?
Well, I think we should see it as a donation within the context of vaccine inequity, in the context of countries such as the US that have bought up most of the doses, and we then really struggle to get hold of them. So we should acknowledge that it is an effort to break that, but we should also see it against the context of the United States vaccinating less vulnerable people already, and then using up some of the doses for that. So we know that teenagers are already getting vaccinated in the United States, and soon we may also see children below the age of 12 being vaccinated, and that within the context of Africa still not being able to get enough vaccines for the most vulnerable part of the population, of people of 60 and older. And the take of the US government on this is that they should do both. So they should both donate and also vaccinate their less vulnerable. That's, of course, not the opinion of many people around the world, who would argue, well, leave that first and let Africa get the vaccines to at least vaccinate the most vulnerable on the continent and then move on to your less vulnerable. But the United States choose to do both.
If we get these doses, so these are Pfizer doses, it's an American company, comes from the American government, can we expect maybe the same to happen with Sinovac doses made by a Chinese company through the Chinese government? Could we see that vaccine arrive in the same way?
So we know that we have been offered doses of several vaccines, but there are rules for what you can donate and what you can't. So the vaccines that the US donated is Pfizer, and we have data that Pfizer works against the Delta variant. In the case of Sinovac, the authorization, because it's not registered, no COVID vaccine is registered, it's just authorized for emergency use. When Sinovac got authorization, it was conditional authorization, and part of the conditions was that it submits more clinical trial data, and that is to show us whether that vaccine would work on the Delta variant. And my understanding is that SAHPRA doesn't yet have that information and that data, and before that process hasn't been completed, we can't accept a vaccine for which we don't have data for that yet. So the kind of data that SAHPRA requires is not laboratory data, it's clinical data, and clinical means tested on people. So it's either a clinical trial or it's real-life data from a country where Sinovac has been rolled out that shows us that it works against the Delta variant.
There's so many questions that come through around vaccines, around the impact that they have, and around the entire process. So we still see people who are contracting COVID-19 after they've been vaccinated. It's a reminder, I suppose, of what the vaccine actually does.
Yes, so we certainly see that in real-life data being rolled out. For instance, in the United States, we see that people who have been vaccinated still can contract the SARS-CoV-2 virus. We've seen that in Israel and also in the UK. But the difference is developing COVID when you've been vaccinated compared to developing COVID when you've been unvaccinated is not the same thing. When you've been vaccinated, your chances of ending up in hospital or of dying of COVID is significantly, in fact, dramatically less than someone who hasn't been vaccinated. So that is what we want vaccines to do at the moment. We want them to protect us against falling seriously ill. And if you've been vaccinated, your protection is really very high against falling seriously ill and not filling up a hospital bed, but not dying or not being away from your family or not being able to recover. And that is the main thing about vaccines, although there is data that shows us that your chances of spreading the virus or of contracting the virus is less than someone who has not been vaccinated, although it's not close to zero.
Mia Malan, from the founding editor of the Baker Cisa Centre for Health Journalism, I do appreciate the time tonight on The Pulse. Thank you very much indeed.